Yeah, this trip was certainly, it took a long time to build and make the relationships, and it's interesting because Dr. Pezos-Revilla and I were at a conference presenting with our Cuban counterparts, and we walked by a booth and saw this School of Nursing, and I said, well, let's talk to them because we know that not a lot of nursing schools in the United States have those kinds of partnerships. So out of that, attending that conference, this is, that laid the foundation for this.
Honestly, I didn't know what to expect going down there. I tried not to have any certain things that I was expecting to happen or expecting to see or do. I was just trying to go in with an open mind and just kind of, I had no idea what was going to happen.
Our goal was more about learning about the healthcare system, and it was a little bit less defined, kind of what we would be doing exactly. And with that, so we got the classes, but the additional bonus was that we really got to see a lot of different care areas. And for me, that was really exciting because what I know are the care areas in the United States. So to see, take my experience from the U.S. and to see what it's like there and, what can I learn from that system and take home with me to, to tell other people about, yeah.
I definitely learned a lot about communication. So they don't have the electronic healthcare records that we do, and we have them and everything still doesn't get communicated. But down there, they're so efficient with their communication. If a patient's in the hospital, the family doctor knows that they're there. They pass along the records. They make sure the people in the hospital know what's happening with them. They keep up with all of their patients and know if there's something wrong with somebody, and they make sure they take care of it. And just having that personal relationship where when they go in the house, they're so excited to see them. I just want to be able to build those relationships with my future patients, be able to communicate effectively and have that relationship.
This recent trip particularly exposed me to healthcare, which I knew from the surface, and I actually lived there for several years, so I was able to know some of the goods of the healthcare system there, but I didn't know the intricacies of how it worked. Mm-hmm. So learning about how things happen in the background so that the population gets to see the goods of the services, it's actually very, very revealing to me. And how they, like students mentioned earlier, how they focus their resources on their priorities so that the at-risk people can be served properly.
So to learn about the healthcare system, to visit consultorios, the little doctor's offices that are in every single neighborhood. Yeah. The polyclinics, which is like the next level up, to get to go to the research hospital for oncology in Cuba. And a lot of people might not know this, but there have been 2 drugs developed in Cuba. They're currently in the United States. One is for lung cancer. It's a biologic. With great success with that, but that started at where we were in Cuba, and we were talking to that researcher. He is the head of their biologics program, and was sitting in a conference room like this with us, just answering questions. So to have that kind of access is amazing.